Apicha is a community health center. It's a place where you can go and make sure that your health is okay.
Apicha is a voice for the marginalized and the vulnerable populations. We have served people living with HIV/AIDS who come from the Asian and Pacific Islander racial and ethnic communities, the LGBT community, and communities of color.
The doctors at Apicha, I think they're really great. I feel like I'm getting the care I'm supposed to get, and I feel really comfortable talking to them about everything, including my sexuality and sexual behavior.
It's our responsibility as healthcare providers to educate ourselves to understand about the populations both that we're seeing and those that we're not seeing, and understand why we're not seeing those populations.
We try and help young men to lower their risks for HIV infection through providing HIV testing all throughout the city, as well as free SE screening.
So over time it became clear that Apicha's medical services would be popular not just among Asians living with HIV, but among other people living with HIV, and also for people not living with HIV.
When I came to Apicha 6 years ago as a patient and experienced their care model, I thought it was a secret place in Chinatown that they were keeping from the public on purpose, because I had never experienced this kind of care and this kind of concern. So I thought they didn't want the public to know about Apicha. Of course, over time, I got to realize that that's not exactly true, but in terms of how I feel about being a patient, I feel extra lucky to have come across Apicha.
For many years, I was going to primary care provider in the community that I live, but there was something lacking, and that was the part of understanding as a gay person. Sorry. So at some point in that process, me and my partner decided to come to Apicha.
Apicha is about dealing with change in the environment.
I remember when I first started as an HIV testing counselor, when we would talk to our clients, we would notice that they needed much more care than we were providing, especially primary care. Trying to refer them outside of Apicha was difficult. We would usually lose them to follow up. So having a space here at Apicha, being a real true one-stop shop, ensures that all of our clients' needs are fulfilled completely.
It's very important to really understand the FQHC system, because so much of preventive primary care is critical in making people live longer and healthier. We have to bring in our cultural competence in dealing with HIV and LGBT into that system as well. And it will require quite a bit of training, because historically, FQHCs have not dealt with the LGBT and people living with HIV/AIDS.
And I watched the leadership of Apicha, Therese and her staff, just strategically and methodically put together the pieces to qualify for the FQHC lookalike. It was the most impressive work effort that I had ever witnessed.
Dealing with change means being innovative, piloting projects, as well as doing cutting edge or edgy projects, just as we did very recently to create a trans health and wellness clinic.
We understand health as a total well-being of your body, your mind, and your social life.
Apicha, it's a non-judgmental place for people like me. I get care from Apicha, but I'm not HIV positive. They work with both HIV and non-HIV clients as well. So it's actually good that we have a facility that has all those resources in one place, and we can just come to this one place.
When I was 6 years old, I'm not gonna say that I knew that I was a girl, but I knew that I wasn't a boy. It becomes kind of exhausting to, pretend that, yay, let's watch football.
We try and take each individual as they present. Talking about, well, what gender pronoun would you prefer is a big step for many folks.
I just got a promotion at the job, and I thought to myself, I could not have imagined this before. When I came in here 6 years ago, I could not have imagined that that would have happened.
It's a lot of work, and and many doors are still closed, and they won't be opening anytime soon. But just having the opportunity to keep knocking on them is amazing.
It's very important to reach out to the hardest to reach population or the most vulnerable. Otherwise, you will not create a model of care that truly serves society as a whole.